A very good afternoon to everyone. Greetings from the team of KIMS Hospitals and the Department of Gynecology and Obstetrics. This is Dr. Nirmala, and today we are going to speak about cervical health. So, today we are starting with hope. Hope because this is where we all stand with, and this is what we look for. And just before hope, we know there are so many beautiful things and also certain ugly things. So just revisiting the beauty contest, if we see the the terrific combinations of beauty and brains, they've usually won the titles of their lifetimes with certain beautiful remarks and answers, suggesting that motherhood is the most beautiful and the unique form of being a human being. So this is certainly something which is very beautiful and appreciable. And but of course there are certain ugly aspects to the same. And here we are today focusing on few of those to know how they affect us and how we can help them, how we can prevent them. So cervix, this is the next slide, please. So today, why are we discussing about cervix? Because the cancer of the cervix is something which is a very bad part of being a woman's life. And of course, not everybody is affected, but the families who have undergone this, they know how bad it is, and we definitely want to prevent this entering into many of our lives. So if we look at the latest statistics, we know that roughly 1.24 lakh women are affected every year. And of these, almost like 78,000 lose their life. This is a very, very big figure. And also it is the fourth most common cause of cancer in the women. Also, it is the second most common cause of death related to cancer and in all the young women. And this is the global picture. And unfortunately, of all the global burden, India is accounting for still like 1/4 of the total cases. Next, please. So as we do our medical schooling and come to know so many aspects about the health sciences, I always was reminded of this particular saying from school. We remember, a stitch in time saves nine. This is like most applicable in this context. So, and this is also the same opportunity that we can avail and make the necessary interventions and corrections. Next, please. So there has been a global initiative towards awareness and improvement of the health services by screening and several treatments at various levels. So if we look at the initiative taken by the World Health Organization, January month is recognized as the Cervical Cancer Awareness Month. So it is represented by a teal colored ribbon, and the WHO has decided also to eliminate several historical monuments. And this was done on 17th November 2021 particularly to create awareness about the same. The next, please. So with the intention of elimination of cervical cancer by 2030, there have been several endeavors taken at several levels. So even at a social level, people have like colored the monuments, and like the best example latest is Mahasabaleshwari temple at Sambalpur. It was colored with the same for the same initiative. Now, at a social level, when so much is being done from the medical fraternity, this is again a small endeavor. Next, please. So, starting with the main topic, cervix is nothing but the lower part of the baby bag, the womb, the uterus. The cervix is supposed to be closed and hold the baby till the end of the pregnancy. And thereafter, of course, there are changes which open the cervix and the baby gets delivered. So this cervix is basically entry gate for several kinds of infections as well into the body. So normally, next slide, please. The cervix is supposed to be a normal looking, a pink, healthy structure as we see with the on examination. However, when it gets diseased, the appearance we see on the right side of the picture, and that is an advanced stage of the disease, that is the cancer finally. The next, please. But the good thing about any disease is that it does not jump to the final advanced stage of the disease immediately. There are always some stages in between, and that is the precise opportunity that we take to intervene and hold the disease, or allow for taking necessary measures for remission of the same. So as we see in the slide, there is a normal appearance initially, which progresses to low grade lesion, further to high grade lesion, and finally to a cancer if necessary intervention hasn't been done in the right time. Next, please. So the next picture also shows the different pictures. So nothing is leading to the final stage. So we have to intervene at the right time. Next, please. So coming to the reason, it is again an infamous virus. It is very different from what we are hearing these days routinely. This is called a human papilloma virus, and there are several strains of the virus. So I think it is a no-brainer these days. Everybody understands the various variants and the strains of viruses as they keep on changing, and that is how they keep on surprising us and challenging the researchers, so that we invent necessary measures to control the disease process. The next, please. So these strains, 16, 18, 31, 45 are the common ones. So coming to what this human papilloma virus HPV can do to our body. Many of us know that that is the reason for cancer cervix, but it is only a tip of the iceberg. There are so many other things that can happen, as the picture shows. So there is a possibility of the big chunk is a cervical precancer. Precancer is nothing but the stages of the disease before it becomes a cancer, and this is the place this is the exact time that we aim to identify and intervene. There are other cancers like oropharyngeal. Oro is related to the mouth and the throat. Anal cancers as well, also the vulvar and vaginal cancers, and even the penile cancers for men. So HPV is likely to affect anyone. So it does not have a gender bias, and so everyone has to be vigilant and careful about it. The next, please. So let us understand how this virus spreads. So the virus, as all of us have known these days particularly, it can spread by all possible means. But this particular virus, human papilloma virus, is known to spread by sexual way. That is the most common known. However, there are other ways by which the virus spreads, and this picture shows it. Like mostly it is related to the genitalia, but of course, because of hand touch, it can spread in all these ways possible. So that is why hygiene is a very important part for prevention of the virus. Of course, it does not touch by mere skin contact. Next, please. So coming to the course of the virus. So the virus is not always very dangerous in everybody. Initially, the HPV, the human papilloma virus infection, once it happens, this is the flow chart, which is a little confusing, but also it shows us that there are so many aspects where this is not very dangerous, and we can curtail the infection and hold it at the right time so that it does not progress to cancer. So the initial HPV infection, sometimes it gets cleared with minimal treatment, and if it is persistent, that it stays for long without the necessary treatment and intervention, it can progress to low grade lesion. Still, it is reversible. If not corrected, it will progress to high grade lesion and further to cancer of the cervix. So next slide, please. So let us understand who all are at risk for this infection and for the cancer. So practically every woman who has ever been sexually active is likely to have this infection and thereby cancer. The good part is that most women's bodies are able to fight the human papilloma virus infection and curtail it or contain it. It does not progress to further disease. But sometimes the virus can lead to cancer. So exactly in whom this happens is not predictable. Of course, those who are immunocompromised in the sense those who have been on immune suppression, like the defense mechanism of the body has been suppressed because of either some infection like HIV or because of drugs given for some other reasons like transplant patients. In those cases, the virus can progress more than in the normal people. So particularly who is at higher risk and how can we prevent it? Those who are used to smoking, or they have had many children, or they have been using birth control pills, that is, or contraceptive tablets for a long time, or have an HIV infection, as we just discussed. So those are the situations in which the people are more at risk and likely to carry the infection to an advanced stage. Next, please. So, what are the common symptoms? What tells us that I may have this problem? So, is it time that I get myself checked? How do we recognize that? The most common picture is that there is no symptom. So, this is something which we must pay attention to. We are not going to wait for a symptom or a problem to go for a screening test. Screening means we are looking for the possible problem in healthy individuals before they have any likely or suggestive problems. So when the problems start, how do we recognize them? Any unusual form of vaginal discharge is the first sign that tells us that it is a possible problem and we must get it checked. Other other possibilities are an intermenstrual bleed. That means bleed a bleed in between the periods when it is not the right time. Sometimes there is a bleed just after a sexual intercourse. That is another important sign. Another thing is after menopause. That is, once a woman stops bleeding completely for an year, we call it a menopause. And after that, if there is a bleed, we must think of a possible cancer of the cervix. So these are the definite situations when we should think of it. Other than that, the general symptoms related to cancer are an unexplained weight loss, a loss of appetite, that is, you wouldn't feel hungry well, and also an ill-defined or an unexplained pain in the lower abdomen, or a lower limb ache or a low backache. Also, there is a possibility of blood in the urine or blood in the stools. But of course, this happens with an advanced disease. So, an unusual pain during intercourse or bleeding definitely is a sign which tells us that we must look for it. Next, please. So, as I have been repeatedly telling about looking for it, so it means screening. That is, we are trying to identify the problem before it progresses. So, what are the screening tests? The screening tests include the most commonly heard and known is a pap smear. So I would like to tell here that there were in few institutes, there were some studies conducted about the awareness of pap smear. Unfortunately, most of our population coming to general hospitals were not adequately educated. They are literate, most of them, but still not adequately educated. So pap smear was not known to as close as 40% of the people, which is quite big a number. That also tells us, the medical people from medical fraternity, that we need to make it more, we need to make the people more aware of the available health facilities. So pap tests are also called the pap smear. Smear is nothing but a spread of the cells so that we can study them under the microscope to understand the problem. The another test is a human papillomavirus test, and there is a co-test, that is, which combines both the HPV test and a pap smear. So the picture shows how the test is taken. Although the picture may not be very easy to understand for those who have never got it done. So there is a speculum, that is a kind of instrument which is put inside the vagina to have a look at the cervix. So under good light, we see how the cervix looks to the naked eye. So if there is a problem, or even if there is no problem, we take a soft brush or a spatula. It is quite similar to an ice cream stick. So it is inserted, and of course this procedure is not painful. It touches the cervix and it just rotates so that the loose cells, the superficial cells which are easily lodged off because of the brush, they come out and they are sent in a liquid based medium to the laboratory. And here we get the report usually in 2 to 3 days time. And that tells us various things. So what are the various things that we see? The next slide, please. So before we go to the interpretation of the pap smears, and the other tests, I would like to tell you, when do we start this testing? So the first age when we start recommending the pap test is at the age of 21. Of course, if the person, the girl, the woman has not been sexually active till 21, she might postpone it. But even if she has been sexually active before 21, usually we recommend it. The start is 21 years of age. and thereafter every 3 years, provided the smear test is coming normal or satisfactory every time. And this is till the age of 29 years. Thereafter, from 30 to 65 years of age, the test is recommended. The PAP test is recommended every 3 years, or if we are doing an HPV test or a co-test of HPV and PAP, it is once in 5 years. So above the age of 65, the rule is different. It depends on how the results have been so far. If the woman has been having regular tests and they are always been negative, we can discontinue after 65. However, if the screening has been irregular or there has been few abnormal reports, then we continue the screening even after 65. And here I would like to mention once again that 65 today is not an old age anymore, because we because we see an active life even after 65, and it is every woman's right to have the smear done and have a good life. The next, please. So the screening is definitely applicable for the higher ages as well. So coming to the interpretation of the test results, the HPV test, as we mentioned. So here we are looking at the strains of the virus which is present in that particular body. So if the test is positive, it tells us that there is a high risk type of HPV present in that body, and that necessarily requires a follow-up. We are not going into the details of the treatment here. So here the thing is, if the high risk is reported, we must discuss the report with the treating doctor and go ahead as recommended. And what is the other possibility? That it is HPV negative. That tells us that the high risk human papillomavirus is not present in that body. However, there is a possibility of other type of HPV being present. There is a possibility of this HPV changing its strain, like we have seen over the last 2 years, the virus has been changing its types. Similarly, this HPV which is present can change its variety, or a new infection can happen. So a further test in the next 3 to 5 years is absolutely essential. And the other possibility is that for a long time she has been negative for HPV and now she has suddenly turned positive. So here it can happen because of a new infection or reactivation of the old virus, as I just said. Next, please. So coming to the PAP test results. So this is the most commonly done in government institutes. It is done free of cost. Even in private hospitals, it is done at a reasonable rate. So the PAP smear, it can be either unsatisfactory or a negative, a normal report or an abnormal report. So what do you mean by unsatisfactory? It does not mean that the doctor did not do it well. Mostly it is that, or there is also, they think that there's no problem with the patient as such. It's only that the lab sample, it may not be very clear, in the sense the sample, the number of cells that we obtain may not be enough for an interpretation, or they may be clumped because of some physical changes, or they may be clumped or hidden by other cells present in that sample. So what do? Repeat the sample in 2 to 4 months. What is it is normal? Normal means it is negative for all possible cancers and the pre-cancer types of lesions. So when it is abnormal, there are several possibilities, like an atypical squamous cells of undetermined significance. These are the long medical terms which are not really necessary. So they only tell us that they are all the pre-cancer varieties. And the advanced stage is, of course, the cancer of the cervix. Next, please. Here, I would like to mention one more thing. Sometimes the cancer of the cervix, the frank cancer, may not be identified on pap smear, but here the clinical check by the doctor plays a major role. So even if the pap smear is negative, the doctor can still tell you that there is a cancer and it needs treatment. So how it is explained, I am coming to that next. So when a test is abnormal, what do? We return for a test as per the recommendation. It is mostly done in 1 to 3 years based on the doctor's decision and the patient situation at that time. Okay, and the next thing we do is a colposcopy and a biopsy. What is colposcope? Colpos is the vagina, and scopy is having a look inside that with a telescope. So here we are having a look inside the vagina and the cervix, excuse me, with a good magnification, so that we understand the changes there better, and we can accordingly take a biopsy. Biopsy, as we all understand, is a is taking a small piece of a tissue which we consider abnormal, and we send it to the lab for examination. So here the point to be noted is the piece of tissue which we are targeting and taking out has to be very correctly targeted. If some 30% of an organ is affected and we are taking this piece from the rest of the 70%, we are doing a wrong diagnosis and we are missing the existing problem. That is why colposcopic guided biopsy comes to our help. That is, under magnification, we see the existing lesion and take the biopsy accordingly. And then taking the necessary treatment is the next step. So that is what we do after an abnormal test. So the picture shows the telescope and the vision inside the vagina. Here we apply certain chemicals like a diluted acetic acid or a leucoalcyanidin. And there is one more green filter in the scope which tells us a clear picture of the lesion. The next slide, please. So this shows us the picture of the cervix, which usually is a very healthy, fresh pink. But here we see there are so many blood vessels here, which is an abnormality, and that tells us where to take the biopsy from. Next, please. So I would like to briefly touch about the treatment options. As we hear about cancer, the general concept is that it will require a very big operation and it is going to be the end of life. It is going to be followed by chemotherapy or radiotherapy and all hair loss. And it is like almost there is nothing left thereafter. Here, I would like to reiterate and correct that it is not so for everything, particularly for cancer cervix. I would say it is one of the easiest cancers because it can be easily detected before it becomes a cancer, or it can be easily corrected before it becomes an advanced cancer. So and it does not require a removal of the uterus all the time. It does not require a major surgery all the time, provided we detect it in time. So here, these are the conservative, that is like the simple treatment options where we are not majorly intervening with the body. There are two types of treatments. One is excisional. Excision is a part of the abnormal thing is being removed. That is called excision. So there are two ways. One is cold knife conization, as we see in the picture on the left. The knife is used to take out a conical part of the tissue which is abnormal, and that is all that is needed. The good thing is, if the woman is in the young age and wants to have a baby ahead, this is very much possible after this procedure. So it is not definitely the end of life. The next procedure is LEAP. LEAP is called loop electrosurgical excision. So here we use an electric current in a loop, and that excises, that is removes as we shave a part. Similarly, a conical part of the cervix which is diseased is taken out by this procedure. So the good thing is these are office procedures. That means the patient need not even stay in the hospital. Under very slight anesthesia or sometimes no anesthesia, this can be done and the patient can go home within half an hour. So these are very, very good treatments and these are being routinely done. Next, please. The other conservative treatment option are called ablative. Ablation means we just destroy the layer which is diseased. So this can be done either by cold or by heat. So the cold technique is called cryotherapy. The cryotherapy, it either uses this nitrous oxide or carbon dioxide as shown, which is like kept in the cylinders in our offices and operation theaters, the minor operation theater, I should say. So as in the first picture we see, there is a probe with a tip and it can be handheld like a gun, and it can be put to the cervix at the target area, and we just hold it there for a few minutes and we see there is a beep which comes in our machine which tells us that the delivery of the cold is done. And also we have a visual look at the cervix and we understand that the abnormal area has been destroyed. The next technique is a laser therapy. Of course, here we vaporize the transformation zone. Transformation zone is where the changes are happening, and along with the complete lesion. Transformation zone is a technical term which tells us where the changes start and keep progressing. So we try to address all of it. And all these treatments definitely deserve a follow. So it is not the end of treatment. We have to keep following up, but it is like an office follow. No, nothing major. Next, please. Okay, so coming to the advanced treatments, when the the problem has evolved beyond these stages, when we cannot do the conservative measures, we may need a surgery. This, of course, so based on the staging, the surgery can be needed, or a chemotherapy or a radiotherapy. So surgery traditionally is done open, but these days we have very good technology using a robot for. So the robot has come into all other aspects of life, like artificial intelligence and everything else. The robot has a very good role in surgery as well, in medical sciences, where with least morbidity, in the sense with least discomfort to the patient and least a number of days of stay in the hospital, with less blood loss and a very fast recovery, we try to do the same surgery instead of the traditional way using a robot. We do the same procedure. So the next, please. So coming to the most important aspect of prevention. So as we all know, all of us are taking vaccines. We are talking about the booster doses. So this is nothing new for us now. So now the children ask, like, when are our vaccines coming? So it is like they know that prevention is the way ahead, and that is what we are all looking at. So for this cancer as well, fortunately, this is the only cancer like where a proven vaccine is available. For breast cancer, so far there is no vaccine. For lung cancers, there is none. For lung cancers, brain cancers, we know they have kind of very high mortality, in the sense that there is very little cure available for certain cancers. But cervix is definitely not one of them, and vaccine is definitely a boom. So let us go into the details. So what are the advantages? So this vaccine, it it not only prevents most cases of cervical cancer, but it has an added spectrum too. As I said earlier, that human papilloma virus, it has a big spectrum. So cancer cervix is only a tip of the iceberg. There are several other cancers which are caused because of HPV. So obviously the HPV vaccine is going to prevent most of them. So it is, as we understand, why do we vaccinate the small children? Why don't we wait for them to grow up and then give them injections? It is because any vaccine works best when we give them before they get exposed to the supposed infection. Okay, so that is the basis behind giving vaccines. So thinking on the same lines, applying the same principle, before the girls or boys start with their sexual life, before they get exposed to the human papilloma virus, if we vaccinate them, the vaccine is going to work the best and they are going to have the best prevention. So the vaccine, it also prevents, as told earlier, against other cancers like the vulva and the vagina. In addition, the genital warts, which is a very common menace, like it causes um, a destruction of self-image, and there are also anal cancers, the mouth cancers, throat cancers, and head and neck cancers. Not all of them are because of HPV, but HPV is also an important reason for them, and all those can be prevented by the vaccine. So there is a very big advantage of taking the vaccine, and in both men and women. Next, please. So for whom the vaccine is given and when? For girls and boys between the ages of 11 and 12 years, it is the ideal age to give. However, they can take right from the age of 9 years. So under 15, the doses are only 2. So as already discussed, it is ideal to give the vaccine before the onset of sexual activity. And also there is better immune response at younger ages. And once uh, once a person is infected with the virus, the vaccine doesn't have that big a role. Still, there is a role which we are coming to next. The next, please. Next slide, please. So, what are the doses? Between 9 and 14 years, there are at least 2 doses that are recommended with a gap of 6 months. However, if the vaccine is started after 15, there are 3 doses given as 0 to 6. That means if today the vaccine is taken, 2 months later the second dose, and 6 months from now the third dose. That is 2 months and 4 months is the gap between the 3 doses. Although people through 26, that is after 26, those who are inadequately vaccinated, like people forget taking the vaccine, or it was missed for some reason in that time, the catch-up vaccination is definitely possible. So after 27, what is the policy? What is the recommendation? This is on an individual basis. So it is best that we discuss with the doctor and understand the risk factors of possibilities of other infections or other cancers, and then take it accordingly. And also it depends on the health condition and the other health problems that the person may have. So it cannot be a general recommendation. Next, please. So there are a few frequently asked questions related to the virus, which I would like to address here. So who should not take the vaccine? Of course, those who are pregnant or who have had allergies, allergies related to the components of the vaccine. As you would see in any healthcare product, if you're allergic to one of the components, you should not be taking it. Same rule applies here. And also somebody who has been severely ill or even moderately ill should not be going ahead with the vaccine. We wait for the infection to settle down and then we take it. The other thing is there any benefit when somebody is already sexually active? Yes, of course there is. Because as we said, there are different strains of the viruses. And the vaccine offers protection against the strain which perhaps has not infected that particular person as it. And but suppose one strain is already existing in the body. So is it treated because of the vaccine? No, that is not possible. It only gives protection against the new ones. Next, please. So any side effect related to the vaccine is the most common thing. They are very, very minor, like with any other vaccine, like soreness or little redness or swelling at the site of injection. No major side effect. A little bit of headache, vomiting, nausea, they are all reported with any vaccine, and the same applies to this. And after taking the vaccine, is the pap smear still needed? This is a very important question, and the answer is yes, because vaccine is not a replacement for pap smear, because all these viruses are really smart. They're smarter than us. They know um, how to mutate, how to change their strains and still cause the disease. So pap smear is still needed, and there is no replacement for it as it. And if not in the recommended age group, like what we have discussed so far, up to 27 years and up to even beyond that, what is the way that we prevent ourselves from the infection? So the good ways are, because the virus most commonly spreads by sexual intercourse. So using a condom is a healthy practice. Also avoid smoking and go for a regular pap test. This is the rule by and large. Next, please. So as the human race has been evolving, we have seen that no quitting is the policy. We keep on fighting and find ways and means to improve our quality of life and the way we live. So for every fight won, for each battle lost, for those still fighting, I proudly wear teal and white. Thank you. Thank you very much. Next, please.